Hello, my name is Dr. Tsvetov, and I'm excited to share yet another video with you on my YouTube channel. The topic of today's video is going to be specifically post-operative instructions for patients who have undergone teeth in a day or all-on-4 type of the procedure, either on a single jaw or on both upper and the lower jaws. We are going to cover a couple of topics specifically as it relates to pain control, nutrition, the hygiene, and a few other things that might be relevant for those particular patients. So the most important factor, I think, for patients who have undergone such a procedure is to be able to control the pain effectively. Pain can be of two types. It can be the surgical pain from the procedure itself. Sometimes also it can be the nerve pain, and we're going to delve into that particular issue in a little bit more detail. The normal surgical pain can be controlled with the anti-inflammatory medications such as ibuprofen or Motrin and or Tylenol. We typically recommend that the patients take 400 milligrams of ibuprofen around the clock, at least for the first 3 or 4 days after the procedure. Taking the ibuprofen around the clock allows the patient to have a constant level of the ibuprofen in the system, lessening the inflammation and controlling the pain effectively. Now, if the patient needs to have more pain control despite taking the Motrin 400 milligrams 3 times a day, in addition, they can also take the Tylenol 3 with the codeine. Tylenol 3 with the codeine is the medication that has an opioid in it, and the Tylenol 3 with the codeine and the Motrin tend to work synergistically. In other words, they work together to provide better pain control for these patients. So typically what can be done is 400 milligrams of ibuprofen can be taken. If the pain returns within about 4 hours, the patient can take the Tylenol 3 with the codeine, and that should provide more pain control. And then 4 hours later, another dose of the ibuprofen 400 milligrams can be taken, followed by another dose of the Tylenol 3 with the codeine another 4 hours later. And again, that can be maintained for at least 3 to 4 days after the procedure. Another factor which can be contributing to pain that I wanted to address could also be the neurogenic type of pain. Whenever these procedures are being performed on a patient, during the surgery we have to visualize where the important nerves are so that we don't injure them accidentally during the surgery. This particularly relates to the mental nerves, which gives the feeling to the lower lip and chin, and also the infraorbital nerves that give the sensation to the upper lip and the cheek area. Because we have to, again, physically visualize where those nerves are, sometimes this results in a little stretching of the nerves, which in turn can lead to these nerves being very unhappy and causing pain. And this pain sometimes can, but usually cannot be controlled with the Motrin and the Tylenol 3. And that particular assessment can be done by the doctor. And for those patients, there are a couple of other medications that can be used to address the specific causes or the specific symptoms of the nerve related pain. Another important thing to do after the all-on-4, the teeth in a day procedure, is to control the swelling, the bruising, and the bleeding. The bleeding is usually pretty minimal because we actually put in quite a lot of stitches after the surgery. So even though a little bit of an ooze can be expected for up to 24 hours, in general it should not be a huge issue. We do not routinely ask the patients to bite on the gauze because, again, this would not be entirely productive. The swelling, on the other hand, can be pretty effectively controlled by applying an ice pack to the face, 20 minutes on one side, 20 minutes on the other, and this can be done for up to the first 24 hours after the procedure. After 24 hours, the effects of icing do become a little bit less noticeable. Bruising is definitely something that is to be expected, and it's actually quite normal. It can, on the other hand, unfortunately, be rather stark, and the bruising can extend all the way into the chin area as well as the neck area of the patient. I've had some patients tell me they look like they've been hit by a truck, which is not, of course, true, but for some patients, especially the elderly, they do seem to have more pronounced bruising after this particular procedure. The bruising is likely to last for about 7 to 10 days, and it can be masked to a certain extent by the makeup for our female patients. For the male patients, if they're not opposed to using makeup, I guess that can be applied as well. But for the most part, it's a nuisance, unfortunately. But like I said, it is fully expected to resolve within about 7 to 10 business days. Controlling infection is usually accomplished by taking amoxicillin for those patients who are not penicillin allergic, or an alternative medication for those who are. What I typically do is I prescribe the antibiotic regimen for 2 weeks after the procedure. So it's usually either amoxicillin 500 milligrams taken 3 times a day, or clindamycin 300 milligrams taken 4 times a day. But after the patients are all finished with their 2-week course of antibiotic, usually no further antibiotic regimen is necessary. In addition, we prescribe an antibiotic mouth rinse called Peridex. It is recommended that the patient uses it at least 2 to 3 times a day, swish and spit, and that also helps to control bacterial levels inside of the oral cavity. Another important aspect to consider is maintaining nutrition for these particular patients. What I always tell them during the consultation, and I reiterate it over and over during the follow-up visits, is that it's extremely important that these patients stay either on the liquid diet or the softest possible foods that they can imagine. The reason for that is that we have to remember that the teeth that are placed on the day of the surgery are attached to the dental implants, and the dental implants are actually anchored into the jawbone. For the first 3 months after the procedure, these implants are trying to heal to the bone. They are doing their absolute best to fuse to the bone and to provide the stable foundation for the teeth. If that healing process is in any way disturbed by what we call micromotion, which in turn can be caused by physically chewing or applying forces to the teeth, that will result in the failure of that implant and can actually compromise the whole treatment. So what I tell my patients that it's totally fine to eat everything that you can put in a blender. It's totally fine to stay on liquid foods. You can have milkshakes, smoothies, yogurts. You can have soft foods like cottage cheese, mashed potatoes, scrambled eggs, oatmeal. All those things are entirely fine. Anything beyond that, and trying to eat anything beyond that, will actually put the whole treatment at risk, and we strongly encourage you to avoid that. The last topic that we're going to discuss has to do with the hygiene, because it's a valid question. Well, how do I take care of these teeth after they're placed? When we look at the way that the prostheses look inside of the mouth after they're placed, you can see that there is a clear junction between the line of the prosthesis and the gum tissue. All we ask our patients to do is utilize a water pick or a water flosser twice a day to go along this line and to flush out any food and any remnants that are stuck right here. So to do it in a circumferential fashion over the top, do the same over the bottom. And also, I don't have a picture of that, but if you can envision from the inside of the mouth, there is a similar junction on the palate and just in front of the tongue. So we would like our patients to utilize the water flosser both on the outside aspect and on the inside aspect as well. And again, all they have to do is just try to do that twice a day. There is no reason to brush those teeth. As a matter of fact, brushing can actually erode or undermine the coating that is applied to the teeth when they're made. So we strongly discourage any brushing of the provisional teeth. And again, all that needs to be done is just utilizing a water pick. For patients who want to be really meticulous, what can also be done is using the super floss, which has a little bit of the tougher end on one aspect, and to be able to thread it kind of like this between the gum tissue and the denture and the bridge, and basically go back and forth like this to clean out anything else that might be accumulating around those implants underneath the denture. If I may go back real quick and go back to the topic of bleeding again, I forgot to mention that in addition to having bleeding or oozing inside of the mouth after the surgery, it is also possible to have very small minor bleeding from the nose, especially for patients who have had the zygomatic or the pterygoid implants. It's definitely not anything to worry about or to be concerned about, but we do have to let you know that it is entirely possible. The reason that it's possible is because sometimes when placing the pterygoid or the zygomatic implants, the sinus cavity can be breached, and that will result in small amounts of blood collecting inside of the sinus cavity, which will then try to drain through the nose. So again, usually that type of bleeding is pretty self-limiting. It can involve either one or two of the nostrils, depending on the situation, but again, usually it's a nuisance that actually resolves on its own. I hope you really enjoyed this presentation. I hope it was comprehensive and it was able to address all of the questions that you might have. If you do have any questions after the surgery, please feel free to contact me directly, or you can call the office at 951-302-9100, and we will be happy to answer any questions that you might have. Thank you very much for your attention. Again, my name is Dr. Tsvetov, and we look forward to helping you in any way we can. Thank you very much.